Good morning, everyone, and welcome to today's webinar. Now, for the participants who are on, just during the course of the presentation, I'm going to ask you if you have questions that you post your questions in the chat. We will go through after the end of the presentation and have our panelists respond to those questions. Now, welcome to today's webinar, and we're going to be looking at clinical career pathways beyond national and provincial licensure programs in Canada. I am Dwight Baker, and I'm the mentorship coordinator for the Pegasus Institute, IEHPs mentorship program. With me, I have today's co-hosting this webinar is Saida Fatima Azam, and she is the project coordinator at Pegasus Institute. Now, we're thrilled to have you join us as we explore alternative clinical career opportunities for internationally educated healthcare professionals. Today's discussion is designed to equip you with practical strategies and insights from our esteemed panelists who will bring a wealth of experience in navigating the Canadian healthcare landscape. So whether you're working towards licensure or considering alternative meaningful roles within the healthcare systems here in Canada, this session, of course, aims to provide you with valuable guidance and resources to support you on your journey. Now, thank you for being here today, and we hope that this session, of course, will be both informative and empowering. Let's begin with our land acknowledgement. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse nations, Inuit and Métis people. We also recognize that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississauga and Chippewa bands. As we gather, we pay respect to our elders, past and present, and acknowledge their enduring presence on this land. I'll now have Saida take over from here.
Thank you, Dwight. So this is a quick look at our agenda today. And following our presenters, we also have a panel discussion with a Q&A session towards the end. And before we dwell further, can we go on to the next slide? Yeah, thank you, Dwight. Before we dwell further, I would like to talk briefly about Pegasus Institute itself. The Institute was established from a series of biannual conferences in 2014, acknowledging the ongoing need for initiatives addressing global health challenges through a holistic lens. The symbolism, which is the winged horse from Greek mythology, aligns well with our Institute's mission to enhance global health by promoting peace, environmental sustainability, justice, and equity. Next slide, please, Dwight. Yeah. And for the vision, our vision is to have an effective collaborative network that promotes the interconnection of peace, environmental sustainability, and health for all. And our mission is to engage in collaborative knowledge exchange, network formation, and the research activities that addresses these interconnectedness. And for the pre-webinar survey and for more information regarding the Pegasus Institute itself, I will share the website address now, and you can visit our website to know more about the Institute. And for the pre-webinar survey, I'll pass it on to Dwight, please.
All right, thank you for that, Saida. Now, before we get into our discussion and presentation, now, when you look at familiarity with the Canadian healthcare system, this is crucial for, of course, effective integration of the IEHPs, since this directly impacts their ability to navigate the complexities of the system, adhere to local regulations, and of course, deliver that care that meet Canadian standards. It requires an in-depth understanding of healthcare structure, policies, cultural nuances, and of course, the smooth transition of the IEHPs into practice, reducing that likelihood of error and enhancing patient care. Now, this familiarity is now becoming like a soft skill for those IEHPs seeking to integrate. And of course, the ability to be able to effectively communicate with colleagues, patients, and other stakeholders, ultimately contributing to professional success and integration into the healthcare system. Now, we ran a pre-webinar survey, and in terms of that familiarity, what you have here on your screen are those results that were that we had from the pre-webinar survey. Not looking very good. When you look in terms of that familiarity, 37.5% of those individuals who took the survey, and this is from 16 responses, we have 50% somewhat familiar, and then that 37 or 1/3 of the population being not familiar at all with the healthcare system. In our second item, what other helpful organizations or institutions they've used? So relying on a single organization that does not provide all the necessary services can significantly hinder the IHP abilities to navigate the Canadian healthcare system and delay integration. Limited access to diverse resources may result in gaps in understanding the strategies that you need to explore or implement to ensure success. Now, it could be understanding regulations, certification processes, employment opportunities. All of these are crucial for successful integration. These institutions play a vital role in the process by offering comprehensive support network. They provide tailored services, be it language training, credential recognition, cultural competency workshop, and job placements assistance, whatever those may be. Now, all of these are essential to create a smoother integration pathway. And we had a list of organizations that were coming up in our survey, and you have those listed here. Among the top were Achieve, and Achieve deals with financial resources or financial assistance, and also career counseling and coaching. A lot of persons also listed job agencies. And then there were the neighborhood organization, Kabayan Multicultural Center, National Newcomer Navigation Network, N4, and others. So these are the organizations. And then now we have with us today Irina Edilova, and Irina specializes in healthcare workforce integration and is the IEHP Advisor at Ontario Health. Irina has been working with IMGs for more than 13 years and is familiar with a lot of the comments, complaints, concerns, and hardships, and will, of course, try to address as much as possible during the short presentation. Let us not expect that all solutions can be found within this panel, but look at it as a step in the right direction. Dear participants, help me welcome Irina Edilova, who will discuss navigation strategies and key support resources, including how to connect with Access Center for IEHPs at Ontario Health. Irina?
Thank you, Dwight. Thank you for the introduction, and thank you for inviting me to this webinar. And based on the results of the survey, I really see that many IHPs, they even are not aware of our organization. So I just gave a good portion of telling what we are and who we are here. Let me share the screen with my presentation. And okay, so now, okay, so it's on the screen now, right?
Yes.
Okay, great. So a little bit about myself. My name is Irina Edilova. I've been working as an advisor for internationally educated health professionals at Healthforce Ontario since March 2011. Well, I want to say that I'm not a doctor, so don't ask me any questions related to medicine. So my background is in education. Since 2011, I assisted thousands of IMGs. I predominantly work with international medical graduates, or we call them now ITPs, international trained physicians. So since that time, I just ran the statistics at my 13th anniversary. So the database showed that 696 of my clients successfully integrated in the system as doctors here. 428 matched through CARMS, 58 matched to the residency programs in the US, 53 accepted to the MLP IMG, and 157 accepted to the practice ready assessment across Canada. So what kind of organizations are we? So I think I need to remove, and hopefully I'll be okay. So Ontario Health Workforce Integration Business Unit supports the planning, recruitment, retention, transition, and distribution of health practitioners in Ontario. The Access Center for IHPs provides information and resources to IHPs to help them integrate into the Ontario healthcare system with the primary goal of helping them become trained, licensed, and employed in their profession or an alternative career. So we are funded by the Ministry of Health of Ontario, so our services are free. So whatever services we provide, you do not have to pay for them. So we basically work with all regulated health professions in the professions that are regulated in Ontario. As far as I remember, there are 26 of them. I'm an advisor who works with all doctors, and my colleague, Shami Mohammed, works with all other healthcare professionals. So HealthForce Ontario was opened in 2006. So since 2007, we have the largest database of all IHPs in Canada. So this is the statistics of the basically top 6 client groups that we are assisting. So as you see, most of them are physicians, nurses, dentists, pharmacists, MLTs, physiotherapists, and others represents like 4%. So what do? We support our clients through the continuum. We support them while before coming to Canada, pre-arrival services to support success in navigating the licensing process. We advise them on licensing an alternative career while they're here. And even after they finish, they're already licensed, we support to integrate them into the labor market. So what type of inquiries I get as an IMG advisor? General licensing, how to become a doctor in Canada. I've got low MCC exam scores. Do I have any chance to practice medicine in Canada? If yes, what should I do? I have a gap in practice. How many months or years to practice in my home country so that I can close the gap? What type of practice will be acceptable? Or I failed IELTS language proficiency test 15 times. What to do? I need a job in Canada. I'm a newcomer. What can I do in healthcare? I matched to residency program in the US. How to return to practice in Ontario? What about subspecialty training? I plan to apply to residency. How can I strengthen my CARMS portfolio? And those who apply to the residency positions through CARMS, we advise on letters of reference, CV, personal letter, MSPR, what specialties programs to apply for. We help you prepare for the interview, advise on ranking, AVP, return of service. What about US training versus Canada training, etc. We also assist Canadians who are medical students in other countries. They finish high school here, they went to study medicine somewhere else, Ireland, UK, Caribbean schools. They're also IHPs, IMGs, they come to Canada. We advise them on electives, the MCC exam preparation, timeline, etc. We work with those who are frustrated. You apply and you didn't get any interview. What is missing in my application? How can I improve? I have several unsuccessful CARMS attempts. What alternative career in healthcare should I pursue? So all these inquiries I receive and I work individually with the clients, but not on one-on-one appointments through the emails. I cannot handle all the volume now. And all my advice specific for your situation is through the emails. So this chart shows what kind of services we provide. We have advisory services, sessions and workshops, online resources, and referrals. As advisor to my clients, IMGs, I advise you on your pathway specific for your situation, give you information on licensing, help you prepare action plan, support your applicant to residency training. I advise you an alternative career if you really don't want to move out of Ontario and you do not fit any of the options available here. I connect you with other IMGs and also provide you with the resources for the examination, various test preparation, MCC exam, BC CAP, language test, CASP, FM Pro, C interview, MMI, etc. We have sessions and workshops. Those who apply to PRA programs session, and usually session is a 2-hour. That's why it's not possible within 15 minutes give you all the information about the landscape in Ontario for non-clinical jobs, etc. For this, I have a session that's called Alternative Career Options, give you a pretty comprehensive list of careers that IHPs can go to if they cannot practice in their original profession, pathways to medical licensure for IMGs, finding opportunities in the Canadian healthcare system when I talk about how to make your first step, volunteering, observership, most popular educational programs and specific job search techniques. My colleague Shami Mohammed has session, competencies, culture and communication, integration in the Canadian healthcare system. When CARMS application season starts, which is today, I deliver sessions on CARMS application process and residency interview skills. I also coach the applicants to practice Radio Ontario for the MMI interview skill session, peer-to-peer session, and every Monday from 11 to 12, I answer any questions. It's also like streaming. You come, you register, you ask any question, I answer. We have online resources, and we refer you different organizations like settlement services, educational programs, language training, employment services. We connect you with employers if we know about any job in healthcare, and also give our platform to stakeholders to speak with our client base. So I cannot simply omit this very, very quickly because 90%, almost 90% are not familiar. There are 5 pathways to medical licensure in Canada: jurisdiction approved training, postgraduate training in Canada application through CARMS, practice radio assessment programs, LPIMG, for GPs, family medicine only, and practice eligibility route for specialists only. In Ontario, there are 2 other types of licenses, not full, but independent. It's academic license and subspecialist affiliate status license. You want to know more, come to us, so we'll talk more. Very important knowledge for you to know that there are clinical positions licensed, but you're not physician. Clinical assistants, Alberta, Manitoba, Nova Scotia, New Brunswick, Newfoundland and Labrador, and associate physicians, British Columbia and Prince Edward Island. So what about Ontario? In Ontario, the only, I would say, we call it clinical, but not physician, is physician assistants. And it's basically not only for Ontario, but for others in Ontario is not regulated yet. It will be regulated in April. But PAs are highly skilled healthcare professionals who provide a broad range of medical services, excellent alternative careers for IMGs. PAs are physician extenders and not independent practitioners. They work with a degree of autonomy, negotiated and agreed on by the supervising physician and the PA. They can work in any clinical setting to extend physician services. As I mentioned, they are not presently licensed in Ontario, but they will be licensed beginning April 2025. Currently, they work entirely under the CPSO's Delegation of Controlled Act policy. There are 5 programs in Canada. You have to go to school, you have to go university, and it's a second entry program, which means that you have to have previous education, which means that you have a bachelor degree and direct contact patient work. So that for IMGs, it's a perfect career, alternative careers. The programs are in McMaster University, PA Consortium, University of Toronto, Northern Ontario School of Medicine, and the Michener Institute, University of Manitoba, Dalhousie University in Nova Scotia, and University of Calgary in Alberta. So what to do for the IMGs, ITPs in Ontario? They work in various roles here as clinical assistants, physician's assistants, look here, apostrophe S, clinical research assistant, telemedicine assistant, triage assistant, and health counselors, clinical research coordinators, medical office assistant, medical scribe, patient navigator, medical translator, medical office administrator, medical office coordinator, lactation consultant, HIV prevention coordinator, medical disability claims adjudicator, multi-tissue recovery coordinator, surgical analyst. These are not regulated professions, which means that you don't have to have a license to work. Oftentimes, if you have direct contact with patients, you work under the CPSO policy, Delegation of Controlled Acts. However, many of these jobs I do not recommend to my IMG clients as an alternative career for life. For a while you are still working towards licensure, it's a great option because these non-regulated professions, unfortunately, are not well paid except for some of them, like multi-tissue recovery coordinator, for example. Good job, surgical analyst, good job, HIV prevention coordinator, clinical research coordinator, yes, but all others, unfortunately, no. So, but it's an excellent interim job while you work towards your licensure. Like, for example, look at the role of physician _S assistant outpatient. It's a real CV from Ontario. I'm not going to read everything, just look it over and see how many things someone can do and at the same time improve your application when you're working toward CARMS. So, what are healthcare professions that are most in demand in Ontario after the COVID-19 pandemic? Personal support workers, nurses, all types of nurses, RPNs, RNs, NPs, medical laboratory technologists and technicians, and also mental health professionals. However, if your goal is medical licensure, be strategic about deciding what kind of job you want to have while you work towards your goal. It's very important because the gap in clinical practice can be detrimental when you apply to CARMS. This chart, for example, showing how you can utilize your skills if you have specific training from your home country. For example, if you're a cardiologist, internist, general practitioner, working as cardiology technologist, technician, ECG technician is good. You have research background, clinical research associate, neurologist, neurosurgeons, EEG technician, general practitioners, family physicians, internist, environmental health, community health. Many IHPs can go, and of course with additional maybe education, training based on your background, health policy analyst, health promotion, all kinds of pathologists, laboratory technologists, pathology assistants. Many IHPs without any additional training as medical office assistants, diagnostic radiologists, radiation oncologists, medical radiation technologists. This is you need to go to the program to finish. If you're a OB/GYN specialist, midwifery may be for you. If you're from Europe or Asia, maybe naturopathic medicine doctor could be your goal. Of course, it's regulated profession. You have to go to the 2-year program here. The College of Naturopathic Medicine offers, although super expensive, but it's one of the options. Of course, ophthalmologists, optometrists go optical fields, emergency physicians, surgeons, internists, cardiologists as paramedics. Those IMGs who completed university courses in pharmacology can work as pharmacy technicians and pharmacy assistants. Almost all IMGs may be eligible to apply to physician assistant programs. IMGs with direct patient care experience, GPs, and internists may decide to go to nursing and after 2 years of education, become a registered nurse and work your way towards NP and anesthetists, emergency physicians, and cardiologists, respirologists. The job of respiratory therapist, cardiopulmonary technologist could be your basically choice. This is a correlation between your background and what you can do here in Canada. However, as I mentioned, it's very important how your healthcare job and understand can enhance your application. For this, you need to understand how the programs select the candidates, how residency programs select the candidates, and they select based on 4 criteria. They look at your MCC exam scores, QE1 and the NAC. They look at your recent clinical practice or training. They want you to get exposure to Canadian healthcare system and demonstrated commitment to specialty you're applying to. And also they need personal professional qualities. So, when you get a job in healthcare, how this job helps you to enhance your CARMS application? Well, first of all, it helps you better understand Canadian clinical setting. You do better on the exams. If you work as a licensee or associate physician, it means that you don't have a gap in clinical practice. If you work in licensed or non-licensed healthcare job, any job, it shows exposure to the system. You're easier to train. It shows your demonstrated commitment to specialty, interest for specialty, affinity for specialty. Of course, you need to have a job that is related to the specialty you're applying to. And the personal professional qualities are reflected in the letters of reference that you receive as a result of this job. And this how these jobs will enhance your CARBS application. So when you go to the letters of letters of reference, you know that the programs want your referees to comment on your cognitive skills, knowledge, behavior, attitude, communication skills, working relationship, motivation, punctuality, problem solving, management skills, special qualities, and unique contributions. And when you are on the job, you are showing all these qualities like confidence, positive, teamwork, interacting, attending, involving, showing up on time. Therefore, they are able to comment on all these qualities. And the job gives you the opportunity to demonstrate all this. So let me show you a profile of a successful candidates, for example, for pediatrics program. So that's from a real CV. Her work experience in Canada was team leader in Vision Clinic, Toronto Foundation for Student Success, and research coordinator, Hospital for Sick Children. She had the research experience, was a research assistant at Fraser Mastered Early Learning Academy and Hospital for Sick Kids. She had 3 publications while in Canada. Her gap in practice was 2.5 years, and she did 3 observerships: pediatric surgery, pediatric orthopedics, family medicine. She matched the pediatrics program. The profile of a successful candidate for family medicine. Her work experience was physician's '(S) assistant in Toronto, family medicine clinic, but she did lots of Canadian medical education, professional development courses, like look here, with the family and community medicine at U of T, Health Quality Ontario, CMA Health Summit, the Family Medicine Conference at University of Toronto. And also she was involved in the school where her children, when she was the chair of the school, and that's how she was able to demonstrate her leadership experience. This is just an example for you. So what are the strategies for integrating into the alternative clinical roles? Well, first of all, my friends, I want you to know that over 13 years of working with the IMGs, I know that if you're a doctor for life. And 95% of all IMGs who come to Canada want to be doctors. So start with verification of your medical credentials in Physicians Apply. And depending on what pathway you want to choose what you want to verify, like medical degree, transcript, internship document, postgraduate training document, specialty certificate, license. Do it at early stage so that it doesn't present as a barrier later. Many IMGs are losing the opportunity to get into the program once their credentials not verified. Pass the QE1 and NAC with competitive scores, because if you're aiming at applying to residency, that will matter. Know the healthcare and medical job titles, understand the roles, education and skills required for the job, understand how and where you can utilize your skills and knowledge. Once you understand what kind of skills and knowledge you need for the particular job, acquire these knowledge and skills needed in your profession. It could be on-the-job training or through the formal education or training formal ways. You need to also have Canadian work experience. And it can be, it's natural. Don't be upset that your employer expects you to have Canadian work experience. Even volunteering, even shadowing, job shadowing, even having a placement when you go to the educational program, it's your Canadian work experience. Enhance your soft skills that are applicable to new workplace culture and context, like communication skills, social interaction, work style, attitudes. Polish your interview skills at an early stage. And of course, you need to create targeted resume and cover letter and supplementary application documents. Apply, and not just apply, follow up, send thank you notes, follow up, not indefinitely, of course, but at least 2 times. And please register with us. because we are the hub when you get lots of information and the most accurate information. Keep connected. I want to show you, for example, like through my assistance with different employees in Ontario, we helped the IMGs and IHPs to get a job, like a multi-tissue recovery coordinator with Trillium Gift of Life Network, research and clinical assistant neuromuscular clinic at the Toronto General Hospital, research assistant / coordinator for International Center for Surgical Safety, clinical assistant patient educator Ontario's Men's Health Clinic, surgical analyst Black Box Project in St. Michael's Hospital, vision clinic staff, the Toronto Foundation for Student Success, patient care coordinator for private multidisciplinary clinic, and human scribe and data annotator for the project to improve the practice of care through an AI-based digital scribe. So like these are just example what kind of jobs we help and connected, like the employees can contact us and we send notification to the targeted audience based on your skills. So our contact information is here, email is here, visit our website, and that's it. I'm done.
Okay. Thank you very much, Irina. Quite an informative one there. All right. And I hope that our IMGs and or IEHPs by extension that are on the platform, of course, you were taking all of those notes. And of course, we'll connect with Ontario Health and see how best they can support your integration needs. All right, now let's keep it going. So I'm just going to be sharing my screen again. Now, in the or other pre-webinar survey question here, looking at human resources in health. Now, the majority of participants identified networking, upgrading credentials, and exploring alternative healthcare careers as their primary strategies for integrating into the Canadian healthcare system. Now, these approaches somewhat highlight some of the proactive steps that IEHPs are taking to uncover, overcome the barriers and successfully enter the workforce. But when we look in terms of the challenges that persons encountered with integrating into some of these healthcare roles, common among those challenges, discrimination, recency of practice, and there is competition. Now, when we look today, we're going to be having Paolo discussing, of course, some of those strategies that our IEHPs can explore to help and overcome some of these challenges that you're seeing noted here on our screen. All right, so how to connect with those institutions or some of those strategies to improve your success or land you a career in healthcare, be it alternative healthcare career pathway while you prepare for licensure in Canada. These insights, of course, set the stage for Paolo Varias, and Paolo has quite a bit of experience in long-term care. Is the Associate Director at Niagara Region, and also sits on the board at WES. So if it is that you have questions as well about those WES World Education Services pathway, then of course you can ask those questions, and I hope that he'll be able to respond to those. And again, also has quite a bit of experience as well in higher education. Please help me welcome Paolo Varias, who will be speaking to you next.
Thank you, Dwight. Hello, everyone, and good morning. So I'm just gonna share my screen. That's not what I want. Okay, so good morning, everyone, and thank you for joining us in our session today. And thank you, Irina, as well, for your discussion. That was really, really an amazing start for the day. And thank you, because I think it's a very, very good segue, but you actually also helped me a lot in terms of setting the landscape, but at the same time is adding more context. So I'm not going to be, there's, I think, a lot of pieces as well that I found a bit like crisscrossing between our discussion, but I'm not going to repeat those because Irina actually really discussed it very well. But I'm probably going to be speaking a lot in terms of some of my experiences, what I have seen in the sector, but also share with you my lived experience, because I think before I start is I'm going to share to everyone here that similar to you, I went through the process. The big difference is that I am not a physician or an internationally medical graduate or an IMT to in comparison to majority of you who are in the call today. So I'm an RN originally from the Philippines, and I moved here in Canada in 2014. And at that time, Canada was in a period wherein it's very, very difficult to become an RN. Like that was the period wherein there is, let's say, I will create a network of, let's say, other nurses from the Philippines. There's, let's say, 20 or 30 of us that I knew during my time who were in the process. And during my time, there were only 3 of us who actually made it. And then all the rest didn't make it to become an RN during that time. So it's very, very difficult during that time. But I am thankful that within the last 3 years, and I think if not for COVID, and I guess I could say that if there's anything that I could be thankful about COVID is I think it highlighted some of our human resource challenges in the sector that allowed that allowed the health sector, our policymakers, as well as our key people from the ministries to really figure out how to actually make it work and how to actually expedite the process. I am not sure how many of you have been here, but on my case, I've seen how it changed within the last 10 years in terms of the process. And I think that's just something that I want to share with everyone, that things are changing, things are getting better. Well, I'm not saying that things are easy now, but I think the better days are coming in terms of the process. And partners such as Ontario Health are really, really helpful in terms of helping us navigate this kind of challenge in terms of how to how we can actually achieve that credential that we're looking for here in Canada. So I have a couple of objectives in my discussion today. So one is I would be discussing some of the challenges faced by IEHPs here in Canada. I'll be also discussing to you some of the strategies to help you overcome some of those challenges and successfully integrate into the Canadian healthcare workforce. And also, how do you navigate that credential evaluations, upgrading your qualifications, leveraging your networking, and aligning your international experience with the Canadian healthcare standards? So what are some of those challenges of the IEHPs in the Canadian healthcare system? I think this is not a secret to everyone, and Irina have touched this as well earlier. So one is credential recognition. It's always one of the biggest barrier wherein there are process by process and step by step. And one of the challenges I think that here in Canada we are not really great at is we were not able to really streamline these processes. Um, in our case for nurses, and if there are nurses here on the call today, we are talking to 3 different organizations, actually 4, for you to acquire your registration as a nurse. You have to talk to the National Nursing Assessment Service. You have to talk to the College of Nurses of Ontario if you're in Ontario. You have to talk to the Touchstone Institute if you have to do diagnostic examinations or objective structured clinical exams. And then you have to do your IELTS or English or French language examination. So you're talking to 4 different organizations to actually just get your registration. And I still wonder, like from that time that I wrote my exams, since 2014 up until today, like that process is still the same. You're still talking to 4 different organizations. And these are some of these barriers that we face. The other issue with this credential recognition is that this is not free. It's you have to pay for it. One of the pieces that I have been also saying to the ministry in some of my conversations recently is that the ministry is coming up with great ideas. As an example would be, and I'm not sure if it's the same with the IMGs, but for nurses, as an example, is there is actually an opportunity for them to reimburse all the costs that they have incurred in relation to paying for their examination fees, for the assessment fees. Those can actually be reimbursed at the end once you acquire your registration. But for me, my take on that, for someone who had this lived experience, that's very tough because upfront cost is always challenging when it's so I always think about a family coming here in Canada as an example, and you have multiple kids and you're coming here. Your priority is always to make sure to put food on the table, to make sure that the kids are going to school, to make sure that you're paying your rent and all those kind of things. And the ability to pay for this credentialing processes, that is expensive. And where are you going to get the money? And this is where I'm always providing that feedback that I think we need to move that. Instead of doing or giving the reimbursement at the beginning, is why don't do it as a bursary program wherein you give the funding at the beginning, because the cost is always a barrier. Last year, the World Education Services actually conducted a survey among internationally educated nurses based in Ontario. And what they found out is that out of hundreds and hundreds of IENs here in Ontario, more than half of them haven't started their journey to become nurses in Ontario. And that's a challenge. The major reason, financial barrier, because they can't pay for the assessment fees. It's very expensive. And my assumption, probably for the physicians, it's probably more expensive for the assessment fees that it will incur you for your profession than nursing. So that's one of the barrier. So, and the other barrier is some of the licensing requirements. So some of them, of course, as you know, it requires some bridging programs. And these bridging programs, again, are not, and it's not for free. It's not like you're just going to walk in the park and you're going to sit down and then you're going to acquire and meet the requirements after completing the session. So like you have to pay for that. And again, it's tied up with that issue around cost. Next is workplace integration. Adjusting to the Canadian healthcare culture and system sometimes may take time. I remember one of my first few days working in long-term care after becoming an RN. I always wondered back then, why does our personal support worker serve their dinner at 5 p.m.? Why does it have to be at 5 p.m.? And it didn't make sense to me. And then eventually I found out, well, it's because of an act and legislation and regulation in long-term care. So there are pieces that you do not know. Like I was born and raised in a country where we never had any context of long-term care, where in our context of caring for older adults is for them to be taken care at home with my parents, with my loved ones, with the family caring for them, instead of putting them into long-term care. So that's a big change for me. And it's going to be something as well that you're going to be encountering as you transition and as you integrate yourselves into healthcare in Canada. And there's a lot more things. I remember as well my first day working as a nurse. So the nurse that was orientating me told me, like, you need to get the tower. And I was like, what is the tower? And I didn't know that what she was referring to was a vital signs tower. There are pieces that may sound a little bit different or it's not that we don't know like what to do, but sometimes there are cultural practices or cultural practices even within an organization that are unique to them that you're going to be learning. Another one is language barriers. So you would be encountering patients sometimes where in their first language is not English, or especially right now wherein we've been seeing that the country is becoming more and more diverse, wherein they are speaking, their first language is not English. Sometimes it's not even French, and it could be a different language. And these are some of the barriers that you're going to be seeing in your practice. And the last one that I think I've seen some of the challenges that we face as an IEHP is underemployment. I, even myself, became a victim of underemployment. My first work here in Canada, when I left the Philippines, I was working already as a manager in a healthcare program in a province, in a province. And when I moved here, I couldn't find a job as a nurse, of course, and I even couldn't find an opportunity to work as like even like a personal support worker in long-term care, because there are regulations that require for those positions to have certificates of this, certificate of that. And I do not know much as well in that during that time. So I had to work in fast food. I had to clean houses. Those are my first work in Canada. And but as I move along, is that I try to immerse myself with with education sessions and opportunities that are available in the community, wherein they are sharing information in terms of what are other alternatives. If you cannot be a nurse today, what are your alternatives? And that's some of the pieces that I explored eventually. So in terms of navigating the credential evaluation process for IHPs, it's always very important to understand the process. It can be very, very complex. I remember back then when I was looking at the website of the National Nursing Assessment Service, and my batch is one of the first batches who went through that credentialing process through NNAS. And I wanted to pull my hair because it didn't make sense to me. And I was clueless. Who am I contacting here? Am I contacting the College of Nurses, or am I contacting National Nursing Assessment Service? And NNAS is based in the US, not in Canada. So it was very, very confusing during that time. And the hardest part when they are introducing something that's new, you don't have anyone that you can ask to. Like you don't have like someone who went through the process already that you can just ask. So I didn't get that opportunity. The second one is you need to choose a recognized credential assessment agency. So I think in our case, like it's really very limited. Because as an example, it's legislated, or whether there is a specific requirement for the college that your profession is under. So as an example for us, for the College of Nurses, we have to go through the National Nursing Assessment Service. I am not sure if there is a professional body that requires them to actually go through the World Education Services, but that's another reputable organization where you could actually have your documents be assessed and be reviewed, and like as mentioned by Dwight, full credential, full disclosure. I serve in the board of trustees for the World Education Services. The other one is timely application. I've always mentioned it to the nurses that I've met who are planning to come here in Canada, is start your credential process before leaving the country. Don't start it on your day one here in Canada. If you can start it from your original country where you're coming from, start it there, because it's easier to compile all the documents. You will get the opportunity to, have a conversation with your previous schools, previous employers who actually would fill out certain documents. Those are actually helpful because, and I've learned that because again, when I went through that experience and I had to had a couple of documents be filled out by my previous school and employers, it was challenging sometimes because they had questions, but I wasn't in the country. So they will ask questions to my representative in the Philippines, but it's very hard for them to actually also figure out the answer that they're looking for, because my representative is basically my middleman. So you can remove that middleman if you are actually there. The last one is continuous monitoring. So you may need to follow up regularly to ensure that there are no delays in processing. Like back then, like the process was very, very slow, but I was relentless as well. I keep on calling. What's going on with my documents? Is the assessment ready? Have you evaluated it? Like how much time is left? Dwight, I just remember about the time. Like, am I good with the time?
Yes.
Okay. The next one is a couple of things in terms of effective strategies to upgrade your credentials. So one is bridging programs. So if there are opportunities or like if there are certain gaps in your practice, consider doing bridging programs. And I also encourage everyone not to not to see or look at bridging programs as a negative thing. Look at it as well, wherein there are learning opportunities from there, wherein you're gonna learn something and you'll be able to apply that in your practice. So I'm very familiar with some of the bridging programs as well. And I know as well, and I am cognizant that some of the challenges when it comes to bridging programs, especially for nursing, that the challenges they're very limited across the province, and there is a cost associated with that as well. Licensing exams preparation. It's very helpful if you're creating a group, peers that you can ask with, peers that you can actually prepare the exam with. Luckily, during my time, so I moved here in Canada along with my wife. So there's two of us, and both of us were originally RNs from the Philippines. So when we moved here and we started our journey to become RNs, we did all of those processes both at the same time. So when we get to the period of doing our objective structured clinical exams, as well as our licensure exam, we were actually preparing at the same time. So we were asking each other, we're helping each other. I remember during practicing for the diagnostic examinations that, she would be acting as my patient and I will be the nurse and I'll be assessing her. And that was really, really helpful. And I think I encourage everyone here as well, like if you are going to do some sort of like um, clinical examinations that you may need to demonstrate certain skills, it's always helpful if you are actually part of a group or a preparation group, because it helps a lot in terms of your preparation. The next one is language skills. If it's helpful, enroll in any professional language courses. One of the pieces I've done back then is that I volunteered in a health center. And what I did was I was actually answering phones in the health center. So that was one of the pieces I've done, is to volunteer. And it really helped me a lot in terms of preparing myself to be more effective in terms of communication, be able to have those conversations that are sometimes you don't expect with any of the callers. And it was really helpful. And it gave me an opportunity, other than improving your language skills, but also expanding your network within healthcare. The next one is integrating yourselves into healthcare roles. So it's also nice to do some shadowing and internships. So as an example, at Niagara Region, within the last year, we supported a program brought in partnership with the federal government and the Niagara Multicultural Folk Arts Center. And what we have done is we actually supported IEHPs to actually see and experience and shadow what the operation looks like in long-term care. And it was actually an amazing experience for those participants. A lot of them are doctors. Majority of them are doctors. Some of them are pharmacists. Some of them were nurses, physiotherapists, and they gain the opportunity to really see like how long-term care operates, and what are the different interdisciplinary roles that are available in long-term care and how they collaborate between each other. They've seen how a doctor is seeing a resident in long-term care, and that was a great experience for them. Another one is mentorship program. Find a mentor. So if you know anyone who is already a doctor and it's someone that you trust, maybe talk to that person on a regular basis and let that person be your mentor. And that person also could be the person who can inspire you to go through that challenging journey. At the region as well, we offer the Supervised Practice Experience Partnership Program, or the SPEP program, wherein we support internationally educated nurses transition and gain their safe practice for them to be able to practice nursing. And lastly is cultural competence training. So understanding really the Canadian healthcare culture and practice that helps ease workplace transition. So as mentioned to you, like when I started, there are pieces that was very hard for me to understand as a new nurse in Canada back then. And there was nothing back then that supported us in terms of making us competent in culturally in terms of delivering healthcare. And nowadays is the organizations are embracing this process wherein they are embedding cultural competency training to ensure that their new hires are actually competent in terms of delivering culturally and diverse healthcare. I'm almost done, and I know you're probably all waiting. Leveraging network and resources, it's always important to actually expand your network. So my journey in terms of why I became a board of trustee for World Education Services was because of networking. And it all started way back in 2015 when I was still new in Canada, wherein I attended a session, a random session, in terms of what are the alternatives for IENs at that time who were not able to practice yet. And for some reason, there was a facilitator there who was facilitating the session, and then he was coaching me. And then fast forward, after 5 years, I became a director of nursing, eventually became an administrator of long-term care. And then all of a sudden, after 7 years, he reached out to me and said, "Hey, how are things going?" And I shared with him my success on where I'm at that time. And then eventually my story got shared with Wes. And after 2 years, now I am part of the board of trustees of World Education Services. And the piece that I'm bringing in those conversations at West is really bringing that lived experience of internationally educated health professionals. Because for me, I always say this, when people are telling me that we know it's hard, I always tell them, no, you don't know how hard it is. Because for me, not until you went through this process, you will never understand what we went through. Because for my journey, and maybe for the journey of a lot of you here, it's very, very difficult. And I think difficult is maybe even an understatement. Another one is utilize government resources. Irina presented great things today. I'm not gonna expand anything more. I think she covered everything. There are many, many resources available. Please, please take advantage of those. Back then, there's not a lot of opportunities and resources that are available for you. But now it has improved a lot. So take advantage of those. And in terms of aligning your international qualifications, look at any of the job posting. Make sure that you're customizing your CV, like what Irina has said, your CV, look at it. Look for the qualifications. If the qualifications are looking for this and that, make sure that you are actually intentional in terms of, acquiring education related to that, or actually learning about certain skill so that you're meeting those qualifications. And make sure that you're tailoring your applications for every job opportunities that's coming to your way. And lastly is, as a practical advice for all of you, is that be patient and be persistent. I know it's very, very difficult, but there's always light at the end of the tunnel. And I know that's very cliche, but I'm in front of you. I went through that process. Maybe my journey is a little bit easier compared to you because I'm not a doctor, but I will tell you that it was a difficult pathway still. But I was able to achieve what I was hoping for. Continue your professional development as well as volunteer. Like, volunteer is a great opportunity. It widens your connections, it builds your network. So please expand that opportunity as well. And lastly, as a closing statement, is that your journey as as an internationally educated health professionals in Canada is a remarkable example of dedication, resilience, and a quest for excellence in healthcare. And as you navigate the unique challenges and opportunities here, your diverse perspectives and valuable expertise are enhancing our healthcare system in profound ways. So by continuing to support each other and embracing the opportunities for growth, you're not only advancing your careers, but also contributing to a more inclusive and responsive healthcare environment. Together, let's celebrate your achievements and the positive impact that you're bringing to Canadian healthcare. Thank you.
Okay, thank you so much, Paolo. And of course, for those strategies and buying, networking, credential evaluation, tailored application, and volunteering, of course, engaging with purpose when you're starting that whole engagement in the system to get what you intend to achieve from it. Now, at this time, I'm gonna go again. Let's look at the last set of survey questions that we had. And for those, just one moment. Now, the last item, and here we're looking at integration information, and this is integration into healthcare roles or into the healthcare system in Canada. We'll look at some of the challenges. And the biggest one that we had coming out here was that the information was not readily available. And in this day of information at your fingertip concept, you'd want to think that, oh yes, it should be there, but still we're finding this challenge. Complex and confusing information, also one of the other challenge that a lot of persons find here. So today we have been discussing alternative clinical career pathways, and we have clinical research and evidence-based medicine. We have with us Andre Williams from the York University, and he's the program manager at the School of Continuing Studies. Taymour Bibi as well, who is a course developer for the program, and they will be addressing clinical research. We're going to be looking at the whole practice in Canada of evidence-based medicine, available courses and certification, how you can get financial support as well, or what are those options that are available to you, and what are those career options that you can explore, of course, having a certification here in clinical research. The beauty about this program as well is that it goes beyond those West pathways. I know for a lot of the regulated professions, you need to, of course, have your degrees or your credentials certified by West in order to get into those careers and also to get into those educational programs. Andre Williams, Taymour Bibi, please tell us how persons can get into these programs bypassing these pathways.
Thank you so much for that, Dwight. And I'd also like to thank Irina and Paolo for their presentations. While I'm cognizant of time, I will not repeat what they have mentioned, but I'll speak more strictly with Taymour on the educational benefits of the clinical research program. So let me just share my screen here to get my PowerPoints. And I will go into presenter mode. If you can see this, just give me a thumbs up just to make sure. Perfect. Okay, so this is the Certificate of Clinical Research housed at the School of Continuing Studies at York University. York University being one of the largest universities in Canada. This is just a quick run through of how we're going to navigate the presentation. First, I'll kind of define who we are as a School of Continuing Studies. And then I'll hand it over to Taymour to talk about what clinical research is in the context of Canada, because that is important. I did see in the chat that there were a couple of questions kind of asking about how to define what Canadian experience looks like. And so we'll kind of define that for you from an educational standpoint, but also from a career standpoint. And then as Taymour explores those potential career paths and how you might be able to leverage your soft skills already developed in your training to get these alternative careers in Canada, I will then follow with an overview of our program in clinical research and why that is relevant, followed by just briefly what the registration and enrollment process will look like on the side of York University. So to start, we are the fastest growing continuing education unit in Canada. And one of the reasons why we are the fastest growing unit is that our programs aren't individual courses, but it is a cohort-based learning model, essentially to get our certification, rather than finding and navigating the individual courses that make up the program. Once you enroll in our program, you're automatically enrolled in all the courses relevant to the certificate. What that means is that the individuals in your cohort that you start with at the first course, they go with you throughout all the courses until graduation. And so what that essentially does is that builds up not just your ability to network with other professionals like yourself, but it also builds up that connection with our instructors. Our instructors are industry experts who are currently working in industry. And what that does for our students is it allows them to connect with the people who are making the decisions for hiring in terms of clinical research in Canada. And so once our students graduate, not only do they have that connection with their other cohorts or their peers, but they also have that added benefit of connecting with industry experts and potentially finding internships, co-ops, placements, and jobs through those connections through our instructors. The last piece that I will say is that our programs are designed specifically with those educational gaps at the forefront. And so to respond to that question that I saw in the chat earlier about what does a Canadian experience look like? Well, when we design our programs, the first question we ask our industry leaders are, what are you looking for training-wise from the students that graduate? And so what they do is they isolate the skills and competencies that are needed, and then we package it into our program so that once you complete the program, there isn't a question about whether or not you have the experience that they're looking for. You have it, you just need to articulate that now to the jobs at hand. And how that's facilitated is through the instructors that we have. And so I'm going to hand it over to Taymour to kind of define what clinical research is in the context, again, of Canada, and then to go into what the jobs might look like.
Yeah, thank you so much, Andre. It's great to be here. Thank you to the presenters so far and for having us here. I'll just share a little bit about what clinical research is and then kind of go into the landscape in Canada and the career opportunities that are available. There's a nice synergy there with people who have a health background, as it's a natural transition into a role of this kind. So what is clinical research? It's research in a clinical setting. We're conducting research with patients and participants. Clinical research professionals have to sort of plan, organize, and run clinical studies in different phases, different therapeutic areas. Our purpose here is to look at efficacy and safety in terms of these interventions, whether they be a medication, vaccine, medical device, diagnostic product, a treatment plan. And we're really looking at running these and seeing if they're successful within the context of a very regulated local and global framework. And so it's very dynamic, it's very engaging, and there's lots of opportunities in this field. And so if we go into the next slide, I'll just give a little bit of a rundown. Who goes into positions of clinical research? It's international medical doctors and internationally educated health practitioners. Irina gave a few examples of people who actually went into clinical research as a role. Trained nurses sometimes transition into this full time. They have the skill set that's needed to be able to do this. We see people who have graduated from an undergraduate in sciences and looking to get skill sets and develop their career further and go in a specific direction. People who have laboratory medical technicians, technologists, familiar with the healthcare field, but looking to grow their skill set and develop their career. And then maybe someone who's already working in clinical research, but looking to establish a really strong foundation in the field to be able to take their career to the next level. And so if this program was really designed from all these perspectives. And is clinical research right for you? Essentially, we're looking for people who have a passion for science and research, willing to learn, enjoy working with people, having strong abilities in written and clear documentation, can manage multiple tasks. Critical thinking and problem solving are such a key part of clinical research, like a variety of tasks and different things day to day, willingness to travel and agile and can deal with changing environments. And we see that a lot in the field where things are always changing, regulations are being updated. And so it's important to have that ability to be agile and move with things as things move forward. And so I sort of gave a little bit of context. I'll now talk about the landscape in Canada and what some of the opportunities that could be available here for those interested in pursuing a career in clinical research. So Canada is a great destination for clinical research. Over the years, we've actually developed a very strong reputation in the quality of work that's done here. And there are certain things in Canada that lend itself to more clinical trials taking place in our country. And so I'll start off by saying Health Canada has a very structured setup so that when we do want to run a clinical study and want to submit it to Health Canada, their turnaround time is about 30 days, which is quite competitive compared to a lot of countries around the world. We're second lowest from a cost perspective, so it makes sense for a lot of pharmaceutical and biotech companies to run studies in Canada. We capture about 4% of the world market, so a fairly significant number there. And we rank third when it comes to our reputation and our quality. So at any given time in Canada, if you look at the map, for example, on the left there, we can have 5,000 plus studies taking place at different research centers, academic centers, hospitals in Canada. And so over the years, this has been recognized globally that this is a good spot to conduct clinical research. And a lot of companies have been investing in Canada as a potential base for a lot of their research work. So we're set up quite nicely to bring in that work into our country. And then I think this program really complements the demand that's coming through and sets people up for success in the field. And so who are the groups that are hiring for positions in clinical research? We have different groups, hospitals that run the research themselves, clinics, universities, research centers. There's a title we use in our field called clinical research organizations. These are specialty companies that provide services, clinical research services, to all kinds of organizations out there. So very specialized, very focused on clinical research. They tend to hire a lot of employees. A lot of times these employees can be virtual and provide clinical research services to other organizations, pharmaceutical companies, biotech companies, medical device firms, ethics boards, boards that are brought together to ensure that the research study is being done ethically and have the patient's best interest in mind. And then, of course, government agencies who review research and set the framework for research in our country. And so I'm going to kind of switch gears now. I'm going to talk to you about a few examples of clinical research operations roles. I'll then explain what the progression looks like for some of those roles, and then I'll switch to some of the other types of research positions that are available as well. So on this slide here, you heard Irina mention clinical research coordinator. This is one of the more common roles in our field. This is the person that is on the ground in the hospital or clinic, interacting with the patients, and really the front line of clinical research. So a lot of foreign-trained medical practitioners tend to fit into this role quite nicely. You have the experience interacting with patients and managing patient care, and this sort of goes hand in hand with that. So a clinical research coordinator would be obtaining consent from patients, completing assessments, making sure all of the assessments that are needed by the study are completed, scheduling next visits, capturing data, entering that data into a database, connecting with the monitor to review the data. It's a very dynamic, very engaging field, and a very natural transition for people who have had experience with patient care in the past. Another role that you can find in terms of an entry-level position in the clinical research field is the clinical trial associate. When you're working at a pharmaceutical company, biotech company, medical device company, you are setting up a clinical study potentially at a global level with multiple countries, multiple sites, multiple physicians and nurses. And so it's really important to have things organized. So the clinical trial associate really assists the study team in organizing that clinical study, setting it up, maintaining it, closing it out, managing all the documentation, systems, tools, budgets, really all the administrative tasks that are needed to set something like this up on a global scale.
And I'd like to jump in quickly before Tim moves to
Andre.
the third example. It's just to kind of highlight that evidently, you'll see that there are different kinds of skills or competencies. Soft skills is what I'd call them, that are being engaged in different roles. And so it's incumbent for me to kind of bring that to light, because it's something that you want to consistently think about. How do you, as an IEHP, think about the skills that you've already developed, and how can you articulate them for the job that you're looking for?
Yeah, very true, Andre. And so, we do a really good job in the program. I think when we developed this, we really didn't just want to focus on the theory of clinical research, which is really important. But Andre's right, we really focused on the soft skills. And so you'll see this program stands out from a lot of other programs in Canada, because it really focuses on the practical soft skills we've developed are quite a big part of the course and mimic real world examples. And so the skill set that you get leaving this really sets you up for success as you transition into the industry, if that's the direction that you're looking to go in. Thank you, Andre. And so I think this last one is the contract research organization that I mentioned. They tend to hire clinical research associates. This is a specialized role where you're sort of home-based and you're traveling from site to site during the week, visiting the research centers, connecting with the research coordinators, making sure that the research is being conducted properly, according to the protocol, the SOPs, the regulations. You're dealing with issues as they come up, and you're responsible for documenting your findings, following up with them, and creating a report of what you saw when you were there at the clinic. So for those of you who are more detail-oriented, like interacting with different people, this could be the right role from that perspective. And so those were kind of three of the more common roles we see in clinical operations. On the next slide, I'll just share with you some of the career progression, and then I'll wrap it up with some of the other roles that are available within the field. And so what does advancement look like in clinical research? These are entry-level positions that are a really good foundation starting point for a lot of people looking to get into the field. And as Irina shared as well, we've seen examples of people become clinical research coordinators. A coordinator could then take on more senior responsibilities. If they enjoy being a coordinator, they can become a coordinator manager, for example, or they can switch gears and say, I've worked at the site, at the clinic, at the hospital. I now want to shift gears and become a research associate or monitor, and I want to oversee the work that other people are doing. And so there could be some different options there. If we look at that CRA role, the monitor role, they could then grow within their organization, become maybe a CRA manager, supporting other CRAs, training other CRAs, or they might say, I want to switch gears now and work on the pharma biotech side, managing the study from start to finish. And so there's a couple of different directions for that role as well. And then the clinical trial associate, you can grow within that organization, take on more responsibilities, become a study manager, or you can decide I want to switch gears. I want to go work at the hospital itself, running the study, or I want to become a CRA and oversee the work that's being done at the site. So there is no right or wrong within operations. I think all of these roles really provide us with a very strong foundation of research management. I myself was lucky enough to go through all three, but they really set you up nicely for a future in the industry. But where you start and the direction you go in is completely open to you. And on the next slide, I'll just really talk about some of the other roles really quickly. So clinical research is just not about operationalizing a protocol. There's many other roles that come into play. So for those of you very interested in data, there are data management roles. These roles are responsible for managing the data. So setting up the database, acquiring the data from the sites, acquiring the data from service providers, bringing it all together. It's a very critical and crucial role for the role of clinical research. We have biostatisticians. These are, if you're interested in setting up the design of the study from a biostatistical perspective or analyzing the data at the end of the study, this could be the right role for you. Clinical scientists, people who develop the research and the protocols and look at how the study will be set up. That's a very critical role for our field as well. Medical is another important one, and I'll sort of spend a little bit longer on this one because often we see foreign-trained physicians take this role on. They're not necessarily practicing medicine in Canada, but they're providing medical support within the context of a clinical research study. And so you don't have to be a practicing physician to take on this role, but you need to understand medicine and provide support to the physicians at the hospitals who are responsible for patient care. And so you're there to guide, support, inform, and we see a lot of people take on those roles within different organizations because it's a nice fit and a nice transition as an opportunity here in Canada. Safety and pharmacovigilance, really important. We have to look at safety signals. Is there anything of concern that we're seeing with a specific intervention, and then reporting it in? Quality, always an important thing in any industry, but especially in clinical research. And regulatory, if you're looking to interact with our health authority agency in terms of trial submissions or medication approval, the regulatory role is quite interesting, quite dynamic. Collating everything available and working with Health Canada to get approval for a study or for a given molecule. And so with that, I think that takes me to the end of my section. I'll just hand it off to Andre, who's going to give an overview of our program. Thank you, Andre.
Thank you, Taymour. So with that, I'll jump into the overview of our program, just to kind of define what the features are for the clinical research program. Now, keep in mind, our clinical research program is part-time, meaning that it is scheduled on weekends only. So that if anyone is pre-engaged with work or they have other things to do during the work week, we've designed the program to allow for people to have that flexibility with our programming. Our program advisory board or council is made up of industry leaders. So these are leaders in industry. Taymour happens to be one of the members of that council. And in addition to that, our instructional team, again, made up of people who have the power to influence hiring procedures within clinical research practice here in Canada. So that's important in that you're not just receiving theoretical components of clinical research, but also practical components based on what is used as best practice in industry. We are the only clinical research certificate offered by university in the GTA, and it's the only blended. Blended meaning that it is not just online components that you take asynchronously, meaning you're taking it on your own time, but we also have live instructional teaching designed either online or in person, depending on what you find is your preference. So if you're someone who can't commute, we have an online offering that is available for you. If you're someone who prefers in-person offering, we have our building located at York University in North York, which you can enroll for if you wanted to do that in the winter. I've mentioned the cohort model before, and that our curriculum is always being adapted and designed and optimized according to the needs or the gaps that are outlined in clinical research. In fact, our team is attending a clinical trials Ontario conference in November with the sole intention of learning what's happening right now in clinical research from other industry experts in order to inform the design or updates of our programming. So if any of you were planning to go to that conference, it's on November the 6th and 7th, happening in Toronto. You'll see us there at York University, so we get to meet in person. We also have a unique capstone course which we'll dive into with a little bit more detail once I move into the breakdown of the courses. So we have 6 courses for clinical research: principles of clinical trials, research and drug development, regulatory and ethical issues in clinical trials, clinical trial design and planning, clinical research operations, clinical trial monitoring, and the clinical research capstone. Now, it does say 6 weeks, but keep in mind again that it is 6 weekends, essentially. That's what's happening because we've scheduled our programming to be on the weekends. What I'm going to do is briefly hand it back over to Taymour to kind of give a brief overview of each of the courses so you understand what they entail if you were to take the program.
Yeah, thanks, Andre. And so everyone, we designed this program about 3 years ago, and we brought industry experts, like Andre said, and we really thought about what would be most valuable if we wanted to hire someone into the field. And so with that lens, we developed this program. The first course is really around just the basics of research. What is clinical research and how is it conducted? And what are the different phases? And what is drug development? The second course really focuses on that regulatory and ethical considerations. So we've had a lot of framework and regulation built around this industry. And there's a reason for that. And so this course is very good at teaching that regulation and all those requirements. Course 3 really talks about designing a study. Why are we conducting a study? What's the purpose? How do we design it? How do we plan it? What are the considerations that really need to come into play? Course 4 is around the operations of clinical research. So those roles I mentioned a little bit earlier, how do they take a clinical research protocol and operationalize it in the real world? What are all the things that come into play? And so this course is quite longer than the others because there's so many considerations that come into play. We walk through, we give prospective students a really good experience and expertise with the hands-on assignments in that course. There's a course just dedicated to monitoring, so that role I mentioned around being a monitor and reviewing data at the sites. And then there's the capstone, and I actually personally teach the clinical research capstone. What we do is we take everything that the students have learned in course 1 through 5, and we put it through a real-world simulation in course 6. So we put these students in the driver's seat, we have them develop a research study, operationalize it, and go through different issues that may come up in the real world so that when they graduate from the program, they're able to hit the ground running and really have the skill set needed to be able to take on a job fairly quickly.
Thank you for that, Taymour. So Again, I'm not going to spend too much time on this. This is just kind of articulating that the soft skills are important. And then as you go through the clinical research program that we offer, it almost teaches you how to take the soft skills you already have and articulate them into the context of the Canadian workforce. And so when there are employers that are saying, we'd like to see that you have Canadian experience, this course is also teaching you that you probably have those skill sets that they're looking for, but you're maybe not articulating them in the way that they need to see. And so that's one of the benefits of our program. Now, again, we have 2 delivery formats, blended in person and blended online. If you're somebody who needs to do remote learning, we have the online version available. If you're somebody who prefers in-person learning, we also have the in-person version available. And then to go into one of the biggest pieces here, our program is open enroll. So there's no application that is necessary. There's no rejection or anything of the sort. Once you register for the program, after looking at the recommended requirements or prerequisites to have, you're automatically enrolled in our program. So you won't have to go through WES in order to get to our program. You can actually enroll. In fact, our fall offering starts on the 23rd of September. So if anybody's interested, we have that there. We also have a winter offering if you want to take some time to kind of research our program some more, ask questions. That is also available. In terms of the language proficiency requirements, I have them listed here: IELTS 6.5, TOEFL 79 to 80, PTE Academic 58, Duolingo 115. So we accept all of these. Again, let me just catch myself here. It's not that we accept all of these are the recommended requirements. So if you have an IELTS score that's slightly lower than 6.5, I'm not stopping you from registering. It is open enroll, but again, I recommend that you have at least these in order to have a smooth progression throughout the program. Again, these are the dates for the program for the fall. Starts September 23 and it ends in November 3rd for the first course and so on. If you do have any questions, I will say the biggest takeaway from here, if you have any questions for us, is continue@yorku.ca. And we will answer all questions there. And with that, this is the end of our presentation for clinical research. Thank you so much for having us.
Okay, thank you very much, Andre and Taymour. And I've been seeing a few questions in the chat. Some of them, of course, have been answered by our panelists. All right, I would just also like to apologize for the absence of Paolo. He had to exit the call due to an emergency. If you have questions for Irina, please, you can just go ahead and put the question in the chat, or you can also go ahead and unmute and ask Irina as well. Irina, there has been 2 requests here for you to just re-show that contact slide. I don't know if you could just display that on the screen for us shortly, please.
Sure. Just a moment.
And while you do that, so there's also a question, are there, internship programs for IMGs? So I think that one, Irina, you may be able to respond to that one.
Sure. Well, if you want, Dwight, I just can simply type, first of all, contact information in the chat room so that it's easier for people to copy and paste whatever. In terms of the internship opportunities, there are no, unfortunately, internship opportunities in Canada for IMGs, just no internships, no clinical training programs, because internship is part of residency training, usually for specialties first year. First year, let's say specialty training is 5 years, first year internship and then specialty training. You have to match through CARMS. So period, no. Maybe you meant something else. Maybe you meant something else, not internship, but something else. Then you need to clarify. In terms of the volunteer opportunities, this is something that whenever we work with clients, we teach them that it's easy. Every hospital has the volunteer section opportunity on their website. You go, you follow the instructions, you do the steps, you complete all the steps. You have to ensure you have references which are not your family members. and of course do certain tests, like medical tests and vaccination, etc., and go for the interview. And usually you find, like, I really truly don't know personally anyone who would say, I tried it for years and I was not able to do the volunteer position. I don't know anyone, because if you know what to do, you usually have it. It's volunteering, it's unpaid job. Canada values volunteer. In terms of observership and shadowing, that's a different story. It's more difficult because you don't know anyone who would be willing to accept you and allow you to be present in the room where physician sees patients. It's about patient safety and about patient confidentiality. So there are certain tactics and strategies how to approach, what to write where to look for physicians, how to go about that. And for this, I have the whole session, finding opportunities in the Canadian healthcare. And I already said, if you're our client, come to my session. If not, register with us. Come to my session. These 2 hours will give you this knowledge. And I even share the sample of the email you can send the physician and how to go about that. So that's what I can say about that. Yeah.
Thank you very much. To Taymour and Andre, are there volunteer opportunities or mentoring opportunities in clinical research?
Andre, would you like me to take that?
Yeah, yes, please.
Yeah, so some of the hospitals do have general volunteer opportunities, and you can be assigned to a group that's doing clinical research, so that there are opportunities there. Less so with mentorship. I don't think there's anything specifically structured, but there may be something that I'm not aware of, maybe at a local level, but not necessarily at a higher level.
The other thing that I will articulate is that I'm also actively working on looking at what that might look like. So I have connections with Sick Kids Hospital, for example, and in my previous role, I'd already set up volunteer shadowing opportunities with the students for that. So I'm looking to see whether or not we can do something similar for clinical research upon some further investigation with my instructional team, but that is in the works. If you want to kind of keep tabs on what that looks like, I think I've dropped the email continue@yorku.ca somewhere here. Contact us through there and we'll keep you up to date on what that will look like.
Okay, and another question. This is also for
Right.
Andre and okay, Irina?
May I add something about volunteer opportunities and research? Usually
Sure.
when there is the question is asked, I recommend to go and familiarize yourself with the site, excellent site at St. Michael's Hospital. That is a very, very detailed, like almost algorithm, how to go about volunteer with research. Find out how you become a research volunteer, and they give you the stepwise approach here. You can either go in by find a researcher or find a program. So like research program. So basically, when you go through this stepwise approach, you can apply the same approach to any hospital, even if it's not beautifully described as a St. Michael's Hospital. That's what I would recommend. Usually there are opportunities, but again, you have to approach principal investigator for with your intention. You have to give enough information, but full information so that they get interested. At the same time, you have to understand that there are lots of applicants for volunteer positions in research, and physicians are busy. So they may not respond, be patient, continue. So that's I would suggest, but that's an excellent website to learn from.
Thank you so much for that addition, Irina. And the other question I have here, what opportunities exist for networking with research organization within the program? So I think that goes to York University.
I can start first, Taymour. So when you register as a student at York University School of Continuing Studies, you're automatically added to a network of professionals, ranging from graduates from the start of the program. And so that's the first thing. It's automatic, it's free, and you get to learn their insights in terms of questions such as, you graduated 5 years ago, where are you now? How did you get there? So those kinds of opportunities are available from York University. We also have opportunities available individually from each instructor. What I've seen from instructors across my programs is we've had students reach out to instructors after the fact to say, hey, I finished a certification, what's the next step? And then we've had instructors say, okay, I have positions open, apply for this. Or we've had students who graduate from our programs 2-3 years down the line say, I'd like to instruct in clinical research, for example, or dispute resolution is another one of my programs. And then they apply. I actually have an interview today for one of my programs for one of the students who graduated. So there are lots of opportunities there depending on who you connect with. The one thing I want to drive home is that because we have such a large instructional team, not only do you have the networking opportunities with the cohort that you graduate with, but also the students at York University and the connections that you establish with the instructors that we have on hand. Sorry, Taymour, did you want to jump in more specifically on what that might look
No,
like?
you covered that
Okay.
really well, Andre.
Okay,
I think
perfect.
you answered that really nicely.
Okay, thank you there again, Andre, for responding to that. And the last question, well, I do see some other questions are in the chat. For those questions that are similar, I'd ask the participants just to review the chat to see, of course, if you have a response there to the question that was that you posed, which may have been responded to earlier. And then the last one I'm seeing here is why is CELPIP not a part of the list? I don't know if you want to respond to that, Andre or Taymour.
Sorry, could you repeat the question, please?
I think this relates to the language requirement. It says, why is CELPIP not a part of the list?
Oh, so that presentation, it was really just space, to be honest. I tried to fit in as many as possible, but if you have a query on the language requirements, just reach out to us at continue@yorku.ca, and I will be able to give you the language equivalency requirements for whichever one that you provide. I've kind of responded to the ones that I saw in the chat already, so that is there. But again, if you have any questions further to that, continue@yorku.ca will be your best point of contact.
Okay, thank you so much. And if you have any more questions, of course, please feel free to reach out to us at Pegasus Institute, and we'll be happy to assist you with the information or connect you to any of the panelists that we have here with us today. Saido?
Thank you, Dwight, and thank you everybody here, and thank you so much for the wonderful panelists here. And me being an IMG myself and being in public health, I found this presentation, this entire session very, very informative, and I'm also confident that all our participants would have felt the same way. Like, I can't believe that 1.5 hours went by. Like, it was that engaging and very informative. So thank you very much for that, wholeheartedly. And I'm sure that all the presentations and all the information might have been very useful, and a great resource in your journey as well. And like Dwight mentioned in the beginning, it might not have given you the entire set of information, but it would have been a very good addition in your journey. So I really, really appreciate all your presence here, and thank you. Thank you from the bottom of our heart. And if you have any questions, please feel free to reach out to us at, I believe I can, Dwight, can you please add our email address as well? So if there is any more questions, like if you want more details or if you want to contact another person, you can reach out to us through the through the email address. And yeah, so I wish all the best to everybody here. And at Pegasus Institute, we really remain committed to supporting people through mentorship and also through knowledge exchange. So if you have any questions regarding the pathways or some information regarding the resources, you can also visit our website, and you can scan the QR code for more information on that as well. So thank you once again, and I wish you all have a great day and a great week, and all the very best in all your journeys. Thank you.
Thank you. Have a good day.
Bye, everybody.
Thank you so much, Dwight, for organizing that. That's really a good event. Okay.
You're welcome. Thank you for joining.
Bye-bye.
Bye.
Thank you.
Thank you very much.
Thank
Thank
Bye.
you.